So now you officially know that the meeting is being recorded. So on Tuesday, we're going to be celebrating ALKtALK at 8 o'clock Eastern time. Please tune in. It's been an amazing job that we've done to raise money for phase 1 trials and other research. So please, Tuesday, 8 o'clock, same Zoom channel, come to meet us. And today we have someone that's an interesting group joining us from paramedical, and I'm going to let them take it away in a second. And I'll start with Ed Speigel, who's the founder of Paramedical. So no polling questions from me today. Ed has some polling questions. Go ahead, Ed.
Great. Well, thanks so much, Mark. Really appreciate it. And definitely our thoughts are with Gina, who is, had some fluid removed from her heart and is recovering and has been a great partner working with and moving lung cancer research forward. So we really appreciate the opportunity to be here. I'm here and everyone is here, I guess, and nobody chose to be here. I lost my dad to lung cancer about 10 years ago. And with divorced parents, my sister on the East Coast, I was basically the primary caregiver for my dad. And it's a very difficult job. There's lots going on and lots to keep track of. And what I was inspired to do was start a website that would help people with patient empowerment and really sort of be able to almost have an electronic caregiver that could help you. And so we've really been working on this for about 4 to 5 years now, and it's a really I think helpful tool, but something that's also very near and dear to our hearts and my heart because of my father's experience. So that's sort of just giving you a background of where I am. This is meant to be an overview tonight of just how to approach patient empowerment, not just from the project we're working on, but also with a lot of other options and other things that you can do to, improve your sort of stronghold over this condition. And so that's what we're here to do tonight. And thank you again for tuning in on a holiday weekend. Really appreciate that. And I'll have my colleague Mariah introduce herself and then get into a brief presentation here of about 20 minutes. And then we'll take Q&A. And we also invite any questions in the chat at any time, and we'll sort of go off script. I know we have a slightly smaller group here tonight, but a very powerful group at the same time. But it is the holiday, and so this is being recorded and others will be able to see it. So any question you have probably is something somebody else is thinking about too. So Mariah, I'll turn it over to you with that.
Sure. Hi, everyone. My name is Mariah Balestracci. I've been working in the lung cancer industry for many years. I actually worked at the Lung Cancer Research Foundation for years before coming on to lead the patient care team at Pure Medical. And I speak with patients every single day and discuss their potential treatment options and help them use our patient education tool.
Great. Thanks, Mariah. So with that, we're going to sort of, jump into this. Let's see, I'm going to present this. So again, we're about patient empowerment here. And we've delineated this into the 5 S's of patient empowerment, which are self, support, situation, science, and society. And I'm going to briefly jump into each one of those just to sort of baseline set, where we see the different areas of patient empowerment. Of course, the first one is self. And like Mariah said, we talk to patients all day, every day. And so we're giving sort of some background on where we see folks who actually have the best sort of, activities and best scripts on patient empowerment. So the first thing is getting yourself ready. And what that means is getting in the right mental state. We see it all the time where it is an absolute shock. And I know sitting in the hospital room with my dad when he was diagnosed and when the doctors came in, oncologists came in and told us, it's just a shock. And you're sort of in a fog and in a haze, what's going on? And you have to go through almost these 7 stages of grief. And it's really about sort of acceptance, working with therapists, we're talking with family members, talking with friends, and getting into a state where you can be proactive about different treatments and taking that on. So it's really about understanding, what you need to do with yourself and taking care of yourself to get to that point where you can, really be an active member in the community. So that's always sort of the most important and first thing I think that people run into. From there, we have support, which is the next one, which are online and offline communities. And here we have some photos from the ALK Positive group, Inspire Facebook groups, the American Lung Association. Longevity is a great partner and does great work with with lung cancer patients. Live Lung has support groups as well. So some of these organizations are leading both online and offline conferences and forums. On the right there, you can see one of the groups we attended there in a Live Lung down in Florida groups, and they're just wonderful places to meet wonderful people who are also not by choice, but facing the same conditions and working towards a solution. So let me see if I can move my screen here. Whoops, got moved a little forward. So situation is where we spend most of our time. This is about knowing your diagnosis, your treatment, and your options. And it's really about understanding, what is everyone else doing? What am I doing? How does this work? Trying to get smarter faster and evening the playing field so that you can really, become a part of the conversation. And these are some of the things that folks are saying that we work with. They want to share, they want to be a part of the community. Thinking about what's next and those kind of things to really have better discussions with their oncologists. Science, this is another important component of patient empowerment. You can add so much to the data and to researchers and their efforts by participating with companies like Rare Patient Voice, for example, and they have surveys and marketing studies that you can be a part of that really feels like you're making a difference, and you are, because you're adding to that ability for them to answer the different research questions that they're looking for. So that's science. And society, here you can see we've even participated in a few of these things. GoTo Foundation does a great job of putting together, like talking to folks on Capitol Hill and talking to your senators and talking to your state representatives. And that's another way to really take control of this, which helps you make a difference in how spending happens, and towards what end does lung cancer research get favored in different budgets. And it's a really powerful process too that also makes you feel empowered and participating. So with that, yep, Mariah, we'll do our first poll.
Perfect. Yeah, Mark, if you can pull up the first poll, we just have a quick question. There it is. So the question is, which is the best way to feel empowered as a patient? Learn more about your diagnosis with similar patients, research different treatment options, find the best hospital or cancer center for you, find the best doctor for you, or speak with other patients about their experiences. So if you guys can just select one of those, and then Mark, you can share the results after that.
And you might want to select many, but I think they only allows you to select one at the moment. Yep.
Okay, I think we got most of the votes in, so I'm going to end the poll.
Okay, so it looks like 35%, the majority, is learning more about your diagnosis with similar patients, and 26% research different treatment options, 18% find the best hospital or cancer center for me, 9% find the best doctor for me, 12% speak with other patients about their experiences. So we're going to talk about all of these things.
Yep. Yeah, we're going to talk about all these. Those are really great to see, people kind of generally spread out, but also focusing on what we, as coming through this as caregivers for our parents, which we have several folks on our team who've done that, also felt like it's most important to understand what other people like you are doing. And so when we do that, when you do want to compare with other patients like you, the first thing you want to find, of course, and I know that this is obviously just ALK Positive group, because everybody here has been very proactive, having their biomarkers established. And so you want to be in a group that is very similar or as similar as possible. And you guys have done a great job here with assembling just ALK positive folks. And then, the stage, can vary, as we know. And then the age is also interesting. You just want to try and find people who are sort of in the closer ranks to you, because it just sets more familiarity when you want to start looking for folks, and getting that group together so that you can find that empowerment stage together. It's just more powerful if it's somewhat similar people. The other thing, of course, is understanding the drugs. So, what is it that you want to understand from everyone else? In this case, you'd have a drug, and then you want to know, okay, well, how many other people are on this drug, which in theory would be something about popularity of the people you're talking to or the people on the website that you're visiting. And then duration, how long does this drug work? I mean, with my dad, it was always a moving target. It's like, okay, we're on this drug for now, and then we'll switch to this other one and we'll try something else. And so it's always a sort of, a maze that you're trying to figure out, but how long will this typically last? And then the trend is really interesting too. That's saying, how many people are switching into this drug? And by having a positive percentage here, you can sort of see that the trend of more people joining this drug is on the rise, which means that it's something that's new to the market. If this is negative, it's usually something that's sort of trailing out of the market. And so you can kind of get a sense as to where you are on what drug. And this again is for alectinib. The other thing that's really important when you are talking to friends, other patients, things like that, or on different sites that have this information, trying to understand what's next, right? And learning from all these folks, and trying to see what is it? Is it another drug? Is it a procedure? Is it, what are all the options? And by understanding options, that's power and that's hope. And that's what we really like to see when people are coming together and comparing all their information. So with that, I'll turn it back over to Mariah. Again, she speaks with patients every day, and hundreds of patients every week. And she's going to lead us through, a general example that's very close to a few of the patients we work with. And Mariah, I'll hand it over to you.
Yeah, so you can see here we have one patient's journey mapped out. And we wanted to show the different routes that this patient could have taken based on the data from our site, and what they actually chose to do. So you can see that they started with ALK-targeted therapy, ceritinib, moved to crizotinib, which 25% of patients do after ceritinib, moved back to ceritinib, then had a lobectomy, then back to a targeted therapy, alectinib, and then is currently taking lorlatinib. Ed, if you want to go to the next slide. And we also mapped out the data again from our site. Ed had just mentioned these 3 categories. So we have them here for 5 very popular ALK treatments and for lobectomies as well. So you can see the popularity. So what percentage of our ALK patients have been on these treatments or are currently taking them? The duration, how long on average the patients on our site who are ALK positive tend to be on these treatments for. And then the trend, meaning the change in usage over the past 5 years. So if it's a positive percentage, as Ed said before, then more patients are going onto that drug. If it's a negative, more patients are getting off of that drug for something else. And then next treatment insights, what treatment or procedures, including radiation, lobectomies, that patients go to next. So I'll just pause for a second to let you guys read this.
I have a general question. That's the duration. Since lorlatinib is new, pretty much to a lot of the patients, the duration would not be really significantly. That 15 months is not right.
Yeah,
Would you
so
agree or disagree?
we'd agree, mainly because you can see that trend at such a high trend number at 400%. You have so many people switching into it that it's still ticking up. So there's definitely, that's a good question, Mark. I mean, there's definitely a correlation between a high growth drug, because most people are just starting on it and it's going to be successful for many, many months to come. So what we sometimes do is switch this into people who have completed the drug and others who are still on it. And that would sort of normalize to some extent. But in this case, you can see lorlatinib being such a new drug and taking off essentially in the space that that yes, this is going to be grow a lot in duration, but it's a, you know, at the moment, this is sort of, we aggregated everybody who's.
So with that comment, then Zycadia, which is negative 33%, would be the trend, is because people are not taking that drug or off that drug because it's an older drug.
Yeah, I mean, that's right. The inverse also holds. So what you're saying, yeah, is that this is an older drug, which means that it had more chance for more people to take it. And, you know, you had some obviously huge success stories. The other thing that's, you know, incredibly important is that our data set here, I mean, we have several, you know, we're up to around 500 people who've submitted medical records. And of this, there's 23 people who are ALK positive. And so our numbers aren't quite high enough either. So we need to make sure, you know, that we always get more folks. So the more folks that participate, the better this data is. But as well, the older drugs will have obviously a bigger chance to get more months under their belt. So that's a really good point, is that some of these high growth drugs are still accumulating more months. Mariah, would you agree with that, or explain it in a different way? Or
No, yeah, I think you explained it well. Absolutely. I think the newer drugs are going to have a way higher trend if a lot of patients are switching onto them, and obviously less of a duration because they're newer. And the inverse is also true, as Ed explained. So yeah, absolutely. Okay, Ed, you can go to the next page. So it's really, really important to have verified medical information that you can base your care off of. When I worked at the Lung Cancer Research Foundation, we always encourage patients to seek out verified medical information, and that's what we deal with at Pure Medical. And we have patients that we speak with every day who also make comments on our site, as you can see here as one example, that talk about their side effects for their treatments and why they had to switch treatments and how their current drugs or procedures have affected their diagnosis as well. And if you want to go to the next page, here are some other examples of these same comments. And you can see here, these are all ALK positive patients, and patients also connect with one another and ask each other questions. And we have 2 comments here from patients who are currently taking alectinib, and 2 for Xalkori, I think. So you can see also we have their user IDs from our site, their age range. And so, as Ed said before, it's really important to connect with other patients that are similar to you in a bunch of different categories like stage, age, and biomarker, and learn as much as you possibly can about the different treatments so that you can make the best decisions for yourself.
Do you want to comment on the first question in the chat?
Yeah, Ed, there's a comment. Do
I'm sharing my screen so I can't see it.
you want me to read it?
Yeah, do you want to read it?
Yeah, it's, do you sell or exchange our data with anyone else? Which we're going to talk about. Do you want to answer that now, or do you want to wait till that slide?
Well, that's a question of Pure Medical, right? I mean, this is sort of, again, focusing on the overall sort of moment of patient empowerment. But yes, the idea here is to aggregate data and sell it through to researchers so they can make better drugs and ultimately, you know, help move us towards a cure, which is what we want. So it does have to sustain itself. You know, usually the models of different websites that are out there, and again, we mentioned a few of them, Inspire, and there's others, you know, WebMD, and you know, they have different models where they try and sustain themselves and create better products. And so, you know, data is certainly a big one. Another way that we could work with patients is connecting them with surveys like you do at Rare Patient Voice, which is another partner of ours, and we'll show that, like Mariah said, in a couple slides here. But please, yeah, we're happy to handle any questions as they come up. But on the monetary, sorry, go ahead.
Would you prefer to go through your slideshow first?
Okay, yeah, we'll just
Why don't we do that?
a couple more slides, so we're getting close.
Yeah, we're going to talk about the data piece of it too in a couple of slides. So just moving on here, it's really important as a patient to advocate for yourself, as Ed mentioned before. And one of the ways to do that is to look at top institutions, see what treatments that they are giving to their patients, what patients are going to those institutions, and trying to find the best care for yourself. And so we just have an example here from our site, Dana-Farber. You can see the different treatments that they're giving to some of their patients as well.
Yeah, so this is interesting because you can see, again, you can find the ideal hospital. So like, what is the best hospital for me? Who's most familiar with the drug that I'm taking? You know, and be most comfortable there.
And similarly, you can look at, to receive the best care, you can look at individual oncologists and try to find oncologists who are familiar with the ALK biomarker and the different treatments that could be options for you. I talk with patients every day, like I said, and I do hear sometimes from ALK patients that they're the only ALK patient at their cancer center. And so it's obviously important to receive care from someone who's familiar with your specific type of lung cancer. And again, it's a great way to advocate for yourself and just make sure that the options that you have and the different treatments that you're taking are the best for you. And
Great.
I think, Ed, with that, we're going to move into our second poll.
Yep.
Okay, Mark, if you can pull up the second question. Okay, so would you speak with your oncologist about different options that you discover for treatments? So just a yes or no.
This is a big surprise, but
Yeah, right. It sort of is also trying to say, what do you feel most comfortable as well? Yeah, so resounding yes. Fantastic. And obviously this is a special group here that is empowered in the sense that they are joining this call and a part of these groups. And you'd be surprised, it's not fully 100% because some people are intimidated by their oncologist or doctor and don't want to upset them. So sometimes, often in the conferences we go to, people are saying, not always, because I don't want to upset my oncologist. But with that in mind, that we do agree, and with my dad, again, we were studying all the different options out there, and so that's what we try to provide, and having a report or something like that. And another person who works really closely with us is Ron Fong. He's very he was voted caregiver of the year by Go2 and a few years ago, and he had the most meticulous notes and ideas and everything bringing into the doctor. And so kind of modeled after his report. We encourage people to make reports, and this is a simple one, again, that we kind of put together, but everyone could do this on your own as well. But knowing where you are essentially is at the top. Where am I in terms of biomarker, stage, age, that kind of thing, and then what kind of reactions are other people like me getting from this drug that I'm on, and how many months am I into it, and then kind of having ideas about what's next. So this report and these concepts of bringing it into your oncologist, and the fact that 100% of the people are saying, yes, this is how we want to operate, this is where the power is. And this is where, again, what we're trying to do is sort of crowdsource everyone, bring it all together, and have a more powerful voice. With that, so this is our final slide here, which is the sixth and final S, which is sign up. And this is not meant to be just sign up for Pure Medical. This is sign up for all the things that are out there, because everything's going to make a difference and help advance, scientists' sort of efforts. And the lung cancer registry, I would point out, through Go2, is something we'd highly encourage people to be involved with. Rare Patient Voice, which we've mentioned, is another company that has a partnership that has 60-minute phone interviews, and you can get paid for your time, because it's very hard for drug companies sometimes to find people for their different studies. Tempus is another really important thing to keep on top of. We've seen a lot of patients recently switching biomarkers and having multiple biomarkers found later. So keeping track of that and making sure that that's sort of up to date. And of course, through our site, we'd love to have you participate. It's your data, your choice. And this is actually where we have the revenue generated. This is every company speaks for itself as to how they generate revenue or what they do. Go2, being a nonprofit, works a bit differently. And but for us, I can speak to that since that was in the chat. And it's really about getting this data together and anonymizing it, of course, not having anybody's names associated with it, but getting that to people who can make better drugs. And for us, that's how, in theory, we haven't made a sale yet. in the sense that we're still growing and still getting more and more people onto our site. So we are going to be very transparent about that and very open about that if and when it does happen. But we think it's a very powerful way to approach this, in the sense that you do need to have some sustainability, but you also have something that's going to help researchers make progress. And if anybody on our site, we call it your data, your choice. You can just turn off sharing in aggregate, turn off sharing individually, and turn off connecting, which turns off your ability, the sharing aspect of that data going to, any research institution or pharma company or something, anywhere where you wouldn't want it going for whatever reason. And then you can still use the site normally. And I think that, this is all about individuals making their own decisions. So it's not meant to be forced upon anyone. And this is just a thank you email or thank you slide. And, if you put your email in the chat, or if you want to email info@puremedical.com, we can send you this presentation. And we have, Mariah's put together an amazing bundle of comments, which are about all the different drugs people are on and all the different experiences they've had. And I think it could be very relevant. So, that's sort of our presentation. So with that, I guess we'll open it up to now I can finally see the questions here.
Yeah, we have a couple more.
Yeah. So let's see what we've got here. So Mariah, do you want to
You want me to read them and then?
why don't do you want to answer one? I mean, you can answer the select ideal oncologist for all these patients, ALK positive patients or general cancer patients.
For the recording, if you can just read the question first,
Oh, sorry.
that'd be
Mariah,
great.
do you want to read that one?
Sure. So the question is, in your select your ideal oncologist, were all these patients ALK positive patients or general cancer patients? So I think that's referring to the slide we had up of the oncologist. That particular oncologist was giving care to an ALK positive patient. Yes. But on our site, you can take a look at all the different doctors and find the different ones the ALK positive patients are receiving care from. And you can also see the oncologists for other biomarkers and just general lung cancer.
Okay, great. And the next question I see here is, I have tried to get an ALK positive document on my team, or doctor, sorry, on my team, and consistently am given an EGFR expert who feels that makes them knowledgeable to treat ALK positive. So even if I had this PureMed info, it might not get me what I want. Thoughts? So my thoughts on that, again, we're trying to build a product here and have an opportunity for folks in North Dakota to see what the super experts at Memorial Sloan Kettering or at Mayo Clinic or UCSF or anywhere, the leading doctors, you'd have access to seeing exactly who these best ALK positive doctors are. And like Mariah just said, that, we showed an ALK positive doctor, you would find one and see exactly what they're recommending and what they are prescribing.
Would that be a map location that you would have on your site, or would that be?
So we do have a map location on our site, and if people get to our site, and Mariah takes them through that too, I think we have 48 states represented in both hospitals and doctors and patients, obviously. So it spreads out pretty quickly. And you can use the map functionality to see where are these ALK positive doctors, who are they, and then you can compare and contrast off what they're doing and bring those in as your representative share and compare reports. And the thing that in our product is that we only show ALK patients other ALK data. So the EGFRs would be essentially in a different category. So that's a good one. Do you want to take the next one, Mariah?
Let's see. Do you connect with the ALK trials also? We have a lot of patients who are on clinical trials on our site, and it will say that on their page. And sometimes we even get the information for what the drugs are, and that will be displayed too. So we absolutely have that info on for each patient, but we don't connect with them directly.
So there's no clinicaltrials.gov or any attachment or anything that we can click on and see what the trials that are going on for ALK?
At the moment, no, but that's definitely in our roadmap. We're trying to build something that's, again, we went through this with our parent, founding it, I went through with my dad, and Willis Chen, who works really closely with us, went through with his dad, and Mariah's been in Lung Cancer Research Foundation. We're just all people who've been through this process. And so that's certainly in our roadmap and something we want to add that's not there right now. But that's also, somebody asked about how, finding the right person for the right clinical trial also is a potential revenue stream for us to, again, keep things afloat. So we're going to be very, very transparent and very open with anything that comes about in that factor. But at the moment, we're really just trying to build value and make sure that we're servicing the problem that we all came through as best we can. And then if that works, in theory, we should be able to find some ways to keep afloat. But at the moment, no, with clinical trials in terms of connecting directly with them. The next question here is from Charmaine, and it says, is pemetrexed considered to be the best medication for ALK patients? Is it chemo? Pemetrexed, I believe, is chemo. It's not one of the direct drugs. I think, like, as we mentioned, lorlatinib is sort of the up and coming drug that seems to be a lot of people coming on. I mean, Mariah, maybe you want to touch on that because you've really focused on all the drug attribution.
Yep. So pemetrexed is a chemotherapy, and usually for ALK patients, the best treatments are those targeted drugs that can target the genetic mutation directly. So we have a lot of patients, as Ed mentioned, who are on lorlatinib, alectinib, all of those treatments that we had in that. All of those treatments that we had in that slide, and where we showed the popularity and next treatment insights. That being said, there are many patients who are on a combination of drugs and have chemotherapy, certainly in that combination with their targeted therapies. There are also patients who are only on chemotherapy, and that could be from having bad side effects from different targeted therapies or having progression. But I do think from the patients that we've spoken with, and just based on the data from our site, it seems to be that the targeted therapies are the best option for the ALK mutation.
Great. And then we have a related question here, which is from the person who asked the previous question, which asked about the oncology slide. And she's saying, it's more of a comment, seemed to be heavy traditional chemo, which was surprising. And again, it varies, as sort of Mariah just explained, but the wonder drugs do seem to be the ones that are the targeted therapies, and those are the ones that are typically making big impacts, I would say. Would you agree, Mariah? Because we're tracking how long, like Mark's question about length of time, and again, like with lorlatinib or one of these drugs that has the high adoption rates, they're still gaining more and more months really quickly. Let's see. Okay, do you want to take the next one, Mariah?
Sure. I also just wanted to add another comment about the last question. Many patients who I've spoken with have been on chemotherapy, traditional chemo, prior to getting their biomarker results back. So if you see a lot of patients who their first line of therapy on the site is carboplatin or pemetrexed, and then they start the targeted therapy, that's usually the case. And the patients talk about that in the comments as well. Next question, do you verify doctors or just patient info? So both. So the patients are the ones who use the site, and they fill out the form for us to request their oncology records. And through those oncology records, we verify who their doctors are and where they receive their care, as well as all of the procedures and treatments and scans that they have. So on the site, on each person's profile, you'll see exactly who their doctors are. And that's also how we populate in the map view and all of that info. So every patient's doctor that's on there is verified as their doctor.
Yeah, and that's what's really the differentiator here. Speaking with different folks who've been through this, and again, our parents have been through this, and it's really hard and to find the right information that's verified and authenticated. And so we are all about getting actual medical records from that are anonymized once we receive them, and then we input that data into our site directly. And so it's a very critical question. And the other thing is that we get longitudinal access to this. So what's another huge bonus of what we do is that we update these reports every quarter. So you're going to get a call from Mariah or her team member once a quarter being like, hey, we noticed without you even coming back to the site or perhaps you could, but it would say, we noticed you switched from this drug to that drug. Now you're more similar to these 25 patients. They went on to this other 4 options after that. And so it's all about always having that next option. and optionality is hope, and that's what we try to provide to people. But getting the medical records is the differentiator of what we're doing here, and that's what we want to contribute to the community, and that's what the goal is how do we move progress even in patient empowerment forward, and that is it, because you're going to see in the next 5 to 10 years a lot of more and more electronic health records, and then it's going to be just like clicking a button. Right now we're still dealing with a lot of faxes back and forth with the hospital, but that is the improvement. I guarantee you in 10 years it's going to be, you're going to be hooked up through your iPhone to the records, and it's going to be share and compare. It's going to be very easy. Whether it's us or not, I don't know. I hope it is, but if it's not, then there's certainly going to be a lot of people helping out in this space. And so that's where we're sort of on the forefront. But medical records themselves, very important. Next question is, does anyone have a sense of what constitutes an oncologist being an ALK positive specialist? How many ALK positive patients? For example, I'm at UCSF with Dr. Colin Blakely, and he said he sees 10 ALK positive patients, I guess at one time. My father was also seen at UCSF with Dr. Jahan, Dr. Thierry Jahan. And, I was bouncing between UCSF, Stanford, and Davis, actually with Dr. Gandara. And there's all kinds of different folks out there. How many ALK positive patients? I mean, our site aims to show you this doctor saw 12, 20, 50, 100 ALK patients or 0. And you can make that distinction. You can see in research, these are the drugs, leading drugs they recommended. This is how many people treated. This is how long, their duration was. And if you want to measure it by, number of patients they've seen, length of life, or you could have, comments and you can ask different people about what the side effects were. You can also see how aggressive different doctors are treating stuff. Are they on those drugs that are the ones that are in the 300, 400% gain category? Are you in, and you can use this UCSF doctor, Colin Blakely, with 10 ALK patients to go inform your oncologist in Mississippi who maybe hasn't seen that many patients. And you can say, look, Dr. Colin Blakely has, this many people they've seen, they've had this much success, they've been trying these drugs that are doing so well. Can we try one? And have that discussion with the doctor. And one thing, the second poll question was intended to be like, sometimes people again are scared to talk to their doctor about changes, about what they can recommend or think about as a team. And if your oncologist is saying, I don't want to discuss any other potential drugs. I went to a medical school for X number of years, and this is my specialty, and I'm the expert here. Then oftentimes they say you should probably look for another oncologist. But anyway, that'll give you a sense there. We don't really have an answer for that. You can decide what makes an ALK positive doctor a specialist, and you can see on our site who's treated who. The next question is specifically for me. I won't let you do that one, Mariah. To Ed, was your dad an ALK patient? My dad passed away 10 years ago, and unfortunately, we didn't have half the drugs or a quarter of the drugs that are available now. The biomarker testing was just starting. He was on a Tarceva clinical trial from Genentech. I don't know. He wasn't able to be tested for the different biomarkers, so we didn't have the specifics of whether he was an ALK or not. I wish we would have, but that's kind of where that is. Mariah, why don't you go ahead and take the next one?
Sure. So the question is Peer Medical a good resource for dosing? We've had different opinions from doctors who have presented to us about lower doses of alectinib. I'd like to be able to hear more patient experiences in dose reduction. Yes. So when we get the oncology records, when the dosage numbers are included on there, that is what we select on our site. So you can see the different dosages, and also a lot of patients. For example, I was speaking with an ALK patient last week, and she had made a comment on her page about a dose reduction of alectinib actually, and how that affected her diagnosis and the side effects that led her to reduce her dosage. So that's definitely something that's covered on our site. And if you did have a question, for example, if you saw someone who's on alectinib and you couldn't tell if they had lowered their dosage, you could always comment and ask them a question about it.
Yeah, and to that level, I mean, it's really, even going from 100 milligrams to 75 milligrams can make a big difference about the side effects and how you tolerate. And also when you get down to a lower milligram, dosage, you can also start to add some of the different chemotherapies. And again, we just see this stuff because we see so many profiles, and it's the same way of getting smarter, faster, just learning by example. And so it is, I would say absolutely dosage matters. And again, because we have the medical records and we have medical secretaries that input the data, it's all, very professionalized and right. And that's what's different here. It's not, what we call sort of, a cousin or a distant relative or somebody who doesn't really actually have the medical records or knowledge in front of them. They're putting that in. So it's somebody who's very familiar and reading it directly from the doctor. And of course, Mariah is speaking with everyone every quarter. So she's also verifying that again from the patient, because there's sometimes where the medical records are wrong and the patient has the better information. So this next question says, some research suggested you may request the patient's username and login password to retrieve medical records. Is this correct? So the way that we do this right now, is through signature of an online signature, what we call a protected health information form. And that's how we get authorization for 1 year to fax back and forth with the hospital to get the medical records. That's how we do it at the moment. In the future, I do think that more and more patients will be accessing through the portals, the hospital portals. And so those are through Epic, Cerner, Allscripts. In that case, you would put in your username and login password. We stopped doing that. We tried that in the beginning, but so many people had so much trouble remembering their passwords and figuring out how to do it all that we actually stopped doing that for the millionth time. But it is, I think, the future. This does not, I want to be very clear, because I was speaking in Chicago with a group there of patients, and they were confused. They thinking if they signed in through their portal, would Pure Medical or would our company have their login details and their passwords? The answer is no. Very clearly, no. We would not have that. An API works where you're communicating directly with the hospital. It's still about interoperability and being able to move your records from one place to another more easily. But the technology behind it still isn't totally there, because when we do log in through the portals, you get some information, you don't get others, and it's very sort of messy sometimes. And that's why we went back to the actual medical record. But in any case, we'd never get the actual username and password, I would say. Do you want to take the next one, Mariah?
Yeah. So will there be more TKIs after lorlatinib? I think that says. To my understanding, lorlatinib is a very new drug, and researchers are constantly working to improve those drugs and make new treatments, better treatments for lung cancer patients. And specifically with all of these, now Ed has said in the past 10 years or so, there is a lot more testing for genetic mutations, and they have the ability to make these really oftentimes a lot easier on the body drugs that are taken by pill. And they are constantly working to come out with new treatments. So to my best understanding, there most likely will be more TKIs after lorlatinib. I don't know, Ed, if you have any more insight into that.
For sure. I mean, definitely. I mean, I wish, I mean, it's a terrible thing to say, but there's never been a better time to have lung cancer than now. And there won't be a better time to have lung cancer than 10 years in the future. The amount of pharmaceutical companies that are focusing on lung cancer is fantastic. And it's only going to get better. And there's only going to be more options. I think I saw it on Bonnie Adario's go to the living room, which they do is a fantastic program. That's also a great empowerment program, which I would highly recommend. But it was something like, in the last 10 years, there's been, 25 to 30 new drugs come out, and that equals the previous 30 years. So it's just been so much advancement, and that's really great. So we're happy to see that. And certainly with the pharma companies we speak with, just to learn what they're interested in, what they're working on. It's always a long list of research that they're focusing on. So yes, more and more is coming, more and more decisions, more and more choices. And like Mariah went through that one, users platform, and you're going to have many more choices. So that's why you need some kind of system that's going to help you figure out all this stuff. It's like that takes a village, notion. So the next question here is, if you lower your alectinib dose and then take chemo and results aren't beneficial, can you go back up in your alectinib dose? So that's a question we don't really answer. We can show you data, but that's really something for an oncologist. Again, we're really here to create. We aren't, we have oncologists on our staff, on our advisory team, but we're really here to show you sort of instances where it can go probably in either way. But that really, I think, is more of a technical oncologist question. Wouldn't you say, Mariah?
Yeah, I think that's something, like Ed said, we can show you data on what has happened with other patients when that occurs. But everyone responds differently. And so using that information to make more informed decisions is always best to.
I think I want to point out the reason that we scheduled this ALKtALK was to flush out really 2 points. And the point is to have legacy with people that are in later stages of ALK and do a roadmap for people that are behind us and learn from them. And the only way you can do that is by giving up your medical records and sharing with a company like Paramedical or others that are in the community of doing this. And so we have legacy, number one, and number two is, as Ed said earlier, which I'd like him to expand on, and that is, how do you see you using our information to help gain us new TKIs for pharma?
Great. Yeah. Well, we're, speaking with folks, I guess to answer the second one, like, Colin from your side, who's done a lot with the survey and things like that. And there are lots of folks out there in rare patient voice. Again, part of our service is connecting you with research surveys that make the most sense. And again, there are pharma companies out there and consulting companies to the pharma companies and research companies that are really looking for folks like yourselves who are in this specific spot and trying to learn more. Again, what's different about us in this industry, and the reason why I've put my last 5 years into this and will do in the future, is that this is verified, authenticated, consent-based participation. So this is not, working with pharmacies to kind of try and track who took what drug and where were the drugs distributed, or working with, different companies like LabCorp or, different testing facilities and sites to try to get mass amounts of data and then try to figure them out. This is about finding individuals who want to consent and want to give what's really the cleanest data that there is, because not only do we have the medical records that are anonymized, but then we have these anonymous comments as well that go with it. So it's what we call EHR plus. So it's the health record plus how is that patient, feeling about those drugs. And I've spoken with many people over the years who have tried to move this ball forward, and it will eventually get there. It is the best amount of data and the cleanest and the truest source of data when we have the actual, grassroots patients participating. And that's why, I've been in North Carolina, South Carolina, Florida, Michigan, Live Lung, and Dusty Joy and her whole foundation does a great job. We need to get this from the patient up, so from the ground up. And that's what we're trying to do here, so that we can get the best data to these research folks. And that's really our underlying movement. And the legacy component, which you mentioned, is also important. And that gives people empowerment, and they can do more with their experience to help that next person who's just starting, because there's unfortunately always somebody next. And again, nobody chose to be here, but how do we manage this and get out of this, and really try and put this condition behind us?
There was a question that just came into the chat, which I think is interesting, and that is, how are you connecting finding ALK patients? You need hundreds more patients for research. How are you funded? It sounds like you have a great staff. Is there a fee?
Yeah, so great question. And, I really like the one that says you really need hundreds more patients for research. Totally agree. And right now we're finding the majority of our patients, actually around 97-98%, through Facebook ads, believe it or not. So we have a very, complex sort of Facebook ad machine, I guess you would say, and it's posting ads to different people and saying, hey, you know, are you ALK positive? Are you EGFR? Are you BRAF? I mean, we're working with every type of marker, and we're trying to aggregate as many people as we can. And we know that it's going to take hundreds. It's not going to take hundreds, actually. It's going to take thousands and hundreds of thousands to really. There's 725,000 people at any one time in the United States alone that have lung cancer. And so we need to get our percentage way up in this sense. But what we're trying to do now is just prove that patients in this groundswell of participation is going to make a difference. And you've seen it in other industries like Waze, where people use traffic and when they're commuting to see where somebody's driving, where there's traffic, and where there's a cop, and where there's a pothole, and they all report that back. And you see it in these parallel industries. It's going to happen here, I guarantee you. It's just a matter of when, and hopefully the timing is right now. We are funded through venture capital. We've raised $3 million so far to fund our efforts. There's never going to be a fee for patients. This is for patients. Ultimately, I would imagine that the bill ends up with pharmaceutical companies, where they're going to be paying to get really sweet, perfect data so that they can make the better drug and have the better idea about what's next. So
And I want to make sure we don't miss. There's a question above that we skipped over, so
oh,
I can.
did I? Sorry. Why don't you take it?
Yeah. So the question is there a way to see from the site any link between treatment regimens and prescribing provider? For example, it would be nice to see if treatment recommendations are coming from ALK experts versus providers who don't have a lot of experience with this biomarker. So yes, absolutely. That slide that we had up showing just one oncologist showed exactly what treatments that they used for their patients. It showed who the patients were and what biomarkers they have. You can see that for every oncologist that's linked to our site. So you can exactly look for a certain oncologist, click on their name, see where they're treating patients, what their title is. You can also see exactly what treatments that they've recommended to patients. You can also click on who their patients are, communicate with them, and see exactly if they're ALK patients. So for example, you could find a doctor who has seen 10 ALK patients, like the doctor that was mentioned before, see what treatments that they're giving their patients versus someone who has one ALK patient. So it could be interesting to look at that. But yes, absolutely, you can see the link between the two.
Great. And just to give a little bit more color, sorry, on our ambitions, we're hoping to start here in lung, make an impact here. Obviously, you know, I lost my dad to lung cancer, and a lot of our team members have lost parents to lung cancer because it's a very prevalent condition. But we hope to, you know, take this same model into prostate, breast, colorectal, even into COPD and some of the other things that we see. So we do have big goals with this. We just do need to get to our hundreds/thousands of people, and hopefully some folks will participate from this call. The next comment is, this is very interesting. Thank you both so much for giving up your holiday Sunday to be with us. You know, you're welcome. And what we do to give up a holiday Sunday is nothing compared to the challenges everybody on this call, or a lot of people on this call, are facing every day. So it's you know, not even a question for us to give up a Sunday versus you know, going in for all these scans and all these drugs and checking out the milligrams. So we just hope this will help you and your loved ones have an easier time. The next question is, this same group, Upal Basuroy, was encouraging us to sign up at the recent Hope Summit. So we've attended the Hope Summit for the last 6 years, I think, and Upal has been a great part of the longevity team, and we really respect what they're doing there. They're a great group, and yes, I don't know, I didn't hear his specific talk, but I'm sure. But I've gone over our site several times, the Upal, and he's generally been very positive about it. So I'd hope that he sort of tells people or encourages people to come, but again, I don't know. I wasn't at that at his talk or wherever that came from. But Upal is somebody we know, and he does a great job there with longevity. And then Maureen saying, thanks for your time. And I think we finally caught up with all the questions. So yeah, I think that's it from our side. Mark, thank you so much.
Thank you.
And Gina, especially as well, for
Yeah, we wish Gina the
and
best.
Colin. And I know you guys have a whole board of folks that are
We do.
doing great things with the ALK Positive team, and you're typically a younger group than the others, and I think great things are going to come about. And
I just want to circle back real quick before we check out, and that is to get started, we just log on to your website. And how long does it take to sign up?
yeah, so our average sign-on time is about like a minute, or what do you think, Mariah? Maybe less. I don't know. 40.
Yeah, so to sign up, we just ask a couple of questions like name, email, phone number, and the name of your oncologist or cancer center if you're filling out the form for us to get the records. And then you just create the account through there. It takes, I would say, a minute max. And then from there, it takes us usually 2 or 3 business days for us to get the oncology record. Sometimes it's even quicker, 24 hours, under 24 hours, to get the records back and get them uploaded and the patient profile all set up, at which point I would be contacting each patient and bringing them through, verifying all the information that we got from their records, and kind of leading them through the site.
Yeah, and you can either put your email in the chat here and we'll send you more information, or you can go to puremedical.com and then we'll reach out. But we're determined to make this work. And like somebody said earlier in the questions, you need hundreds more people, and we need thousands more people. So we're hoping this is, the beginning. It is the beginning, and to get more and more people on.
Thank you so much for coming in to ALKtALK, and Tuesday for everyone, 8 o'clock Eastern time, same Zoom channel. See ya. Thank you, Mariah. Thank you, Ed.
Thanks, everyone.
Thank you.
Thank
Thank you.
Got a lot of clapping behind you, but they're muted.
Should we, Mark, take I guess in the chat there's, I don't know exactly how this works, but will the
When I get the recording, if you want, I'll give you a copy of the chat.
okay, great. Yeah, because
You'll see the recording anyway, so, and you'll have the chat transcript. So we'll
okay,
get it to you.
perfect.
All right. Thanks, Ed. See ya.
Thanks, guys.
Enjoy your Memorial weekend
You too.
tomorrow.
Thanks a lot.
Bye.